Hello everyone. Today we are going to talk about the different type of shock, which mean inadequate perfusion to vital organs. Okay, there is some concepts I want to talk about before we go into different type of shock, as we see here. Uh, First of all, it's the hemodynamic, as we see here. It has a four items. We uh, make them like a machine or a factory, as we see here. We have a pump, which is the heart, which is the cardiac output, and we have a volume or container, which is a PCWB or pulmonary capillary wedge pressure or the left atrial pressure, and we have a pipes, which is a systemic vascular resistance, and we have electricity, which is the CNS sympathetic. Okay, after the hemodynamics, we will talk about some mass and uh, equations. The cardiac output will equal the heart rate multiplied by stroke volume, and there is a direct relationship between them, as we see here. Or the cardiac output will be mean arterial blood pressure divided by systemic vascular resistance, and we have inverse relationship between them. Okay, how we we will solve the question. First of all, we will see the primary defect, which is one of these four items. Then we see the skin, it is warm or cold, and we see the heart rate or the compensation. Okay, let's go for each type of uh, shock. Okay, let's talk and let's make them in three categories. The first category is the cold one. What's the meaning of cold? We talking about the skin. If the skin is cold, it's gonna be one of these three. It will be hypovolemic. What's the mean of the hypovolemic? We have a low volume. That's mean we have a low PCWB. This is a primary defect. Okay. Or a cardiogenic. We have a problem in the cardiac. Low cardiac output. The pump is dead. We have an obstructive one. We have a low cardiac output because there is a block to the pipes or a block to the pump, which is the heart, and we will talk about it. Okay, which means there's likely two types of obstructive, and I will show you in the end of the video. Okay, the other type, which is warm, we talking about the septic and anaphylactic type. The problem is not the volume or the cardiac output, the problem is the pipes decreasing in the systemic vascular resistance. Pipes are wide, so there is a pooling of the blood. Okay, we have a warm skin here because the vasodilatation. Neurogenic, you will have a warm but dry skin because in neurogenic shock you have an electricity which seen is sympathetic will supply the heart, the cardiac output, and the pipes, the systemic vascular resistance. When this cut off, the cardiac output will go off and the systemic vascular resistance will go down and the skin will become dry. Okay, that's it. Let's see this question and see how we will solve it. We have a mean. We have a 55-year-old man suffered of a massive anterior MI. 2 days ago, complained of increased surgical breast. He have a low blood pressure and high pulse, and diffuse bilateral crackles and cool extremities. First of all, we see the primary defect. The primary defect here is the cardiac output or the heart, and the compensation will be the increasing in the heart rate as we see here. Let's put them in the equation. Low cardiac output, low stroke volume, and increasing in the heart rate will be the compensation. The other equation here, cardiac output, mean arterial blood pressure, and systemic vascular resistance. If the cardiac output will go down, the systemic vascular resistance will go up. What about the pressure in the left atrium? The left atrium will go up because the pressure is like behind the left ventricle will go up because the left ventricle cannot push the volume or the blood on it in it. So the blood pressure or the pressure in the left atrium will go up. Okay, and you can solve any question by this algorithm: primary defect and compensation, and the use of this equation, and you will solve any question like this. This is a high yield table, as we see about the arrows, and how we differentiate by the skin temperature and moisture. And we have here the primary defect as we talked